ladies and gentlemen, rural hospitals are really doing quite bad with patients all around because these hospitals are small. Some of these hospitals are so small, they don't even have 20 beds. That's how small they are. And ladies and gentlemen, they're dealing with a lot of critically ill patients and struggling with patients with CV. Now, these hospitals generally have very few people on their staff. And in most cases, they're understaffed because they don't pay well, not even to doctors and nurses. They don't make any money. That's why nobody is really flocking to rural areas to work. They go to the bigger city because that's where the money is. The problem is in rural areas, you got a huge elderly population and they have all kinds of critical issues. And now they don't have the facility to treat them. So, in many cases, the beds are already taken up. So, what they're finding is they're calling around to different hospitals to see if they can transport this patient to another location. And they're now hitting a brick wall. There's a lot of hospitals that just can't take these people, or they got to wait so many hours that patients sometimes don't even make it, they die. There's a story of a woman, 33 years old. She had stage 4 breast cancer and she lived in a rural community, went to the hospital. They had all the beds were full, all of them, between, critically ill people and CV patients. They called around to see if somebody could take this woman. 20 hours later, she passed, leaving a child. They're saying, rural hospitals lack in the equipment and facility size. They just can't take any and everybody. And now, even people with life threatening conditions are having a hard time finding a hospital to be placed in. So, I always kind of keep a watch on the rural area because that's where both of my parents came out of, in Georgia. I know I told y'all that before. So, these hospitals, if you really think about it, have been struggling for a while. I did quite a few stories in rural communities of how bad the opioids and fentanyl and heroin was. Well, that didn't go away. That is still going on in these rural communities. And I did a story about a week ago on, the opioid and fentanyl. All that is still going on. That didn't go anywhere. In fact, they said over the past 2 years, those overdose deaths have surpassed even CV. So we know, what's that? We're pushing a million. They said it has already went past that over the last 2 years. And I know in the city areas, people that had drug addiction, they even suffered through the lockdown if they were going to rehab. Those rehab centers all closed during the lockdown. And they could not see all of those folks that were in rehab. And they said a lot of them just fell off and went back to the drugs. They lost a lot of them that way because of the lockdown. So, my thing is, if you got relatives in rural areas, you should make sure they have a way to get to the hospital if they have to, because these small rural hospitals are what they call critical access hospitals, and they struggle. They are struggling real bad with critically ill people and, the pandemic, the influx from that. And they said, people are suffering disproportionately in these areas because of jammed up healthcare systems. So they were saying that the staff at one hospital was so small, often they would have to scour the region for available beds for patients that were waiting already several hours. They literally had nowhere to put these folks, making dozens and dozens of calls all around the state to see if somebody could take these people. And this is Idaho where this is happening. Mm-mm-mm. So they said those are the nail biters. Can you find a place for these people to go before their condition harms them? Says Dr. Leslie Ogden, CEO of Sumerian North Lincoln Hospital, Pacific Community Hospital, two rural hospitals located on the Oregon coast. While Gritman Medical Center would not comment specifically on one of their patients because apparently one of their patients that waited 20 hours died, and that was the woman with breast cancer. So they said it's gotten so bad, they are now calling for places to put these rural patients in Washington State, Oregon, Colorado, Montana, and Utah just to find an open bed. Wow. Our nurses and our health supervisors are working the phones like it's a commodity trade floor. The system for transferring patients, he says, has been extremely stressed and extremely strained. They probably don't have a lot of people. A lot of these emergency workers and EMTs that would normally transport people, they can't. They don't have enough people. By the time they get to you, you probably could have took care of yourself. It does create more distress. Mary Temlin, chief nursing officer at Gritman, they feel that they're not giving the exceptional care that any patient requires. And in some cases, doctors have no choice but to come up with emergency workarounds. At her hospital in Oregon, Ogden said they had to perform surgeries that their staff and support staff were never trained to do. Oh, that is dangerous. Mm-mm. That ain't even safe. That's not safe. Support staff had to perform surgeries they never been trained to do. That is dangerous. I would never let nobody that's not a trained professional do some surgery on me. That's crazy. We're doing a risk analysis with the patients who could suffer a very bad outcome or even death if we don't act, says Ogden. If that means two surgeons coming together to do a job that normally takes one, can we just get everybody to pull together and save this patient? And even if a bed can be found, transportation can also be a problem because ambulance companies have also been affected by the surge. So they're saying these folks are, calling out sick, or they just don't have enough staff to pick these patients up and transport them somewhere else. All right. They said there is another rural hospital, but it's about an hour and a half outside of Portland, Oregon. Most of those who are being hospitalized and dying during the surge continue to, they said they don't have the Japsine. Their chance of being hospitalized is 16 times higher, and that's according to the CDC. So I think that's terrible, and I think that's dangerous. I don't know about you, but somebody that's not a trained professional is not doing some surgery on me because they are desperate. No. Mm-mm. That's never an option. But y'all, please tell me what you think. These hospitals, woo, I'm surprised they're still holding up the way that they are in these areas. I really am. I mean, shoot, they really got slammed during opioids, and now this. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.